Welcome to another episode of Med Madness. Today we delve into the crucial topic of cervical excisional procedures. These procedures are essential for treating high-grade cervical intraepithelial neoplasias, specifically grades 2 and 3. We'll discuss the indications for these procedures, the complications that may arise, and the role of colposcopy with biopsies in diagnosing cervical intraepithelial neoplasia, or CIN. Additionally, we'll touch on the impact of risk factors like human papillomavirus infection and tobacco use. By the end of this episode, you'll have a comprehensive understanding of cervical excisional procedures and their significance in preventing the progression of premalignant cervical lesions to squamous cell carcinoma. Next, let's look at the two main types of cervical excisional procedures. Cold knife conization. In this procedure, a cone-shaped specimen is excised using a scalpel. This method allows for precise removal of the affected tissue. Loop electrosurgical excision procedure, or LEEP. This procedure uses electrocautery to remove the specimen. LEEP is known for its efficiency and effectiveness in treating CIN. Next, let's discuss the detailed explanation. Cervical excisional procedures are recommended for treating high-grade cervical intraepithelial neoplasias, specifically grades 2 and 3. However, it's important to note that for young women with CIN2, observation is often preferred. Let's start with the risk factors. Human papillomavirus infection and tobacco use significantly increase the risk of developing cervical intraepithelial neoplasia and squamous cell carcinoma. Therefore, addressing these risk factors is crucial in managing and preventing these conditions. Next, the gold standard for diagnosing CIN is colposcopy with biopsies. This procedure allows for a detailed examination of the cervix and the collection of tissue samples for further analysis. Once CIN3, a premalignant cervical lesion at high risk of progressing to squamous cell carcinoma, is diagnosed, a cervical excisional procedure is recommended. Despite their effectiveness, cervical excisional procedures come with potential complications. One such complication is cervical stenosis, an abnormal stricture of the cervical canal due to scar tissue. Cervical stenosis can impede menstrual blood flow, causing secondary dysmenorrhea or amenorrhea, and obstruct the cervical outlet, preventing sperm entry and resulting in impaired fertility. Other significant complications include preterm birth, preterm pre-labor rupture of membranes, second trimester pregnancy loss, and cervical insufficiency. Cervical insufficiency is a particular concern as it can lead to preterm delivery due to the weakened cervical stroma. The risk of these complications is directly related to the amount of cervical tissue removed. Now, let's consider a real-life case study. Consider the case of a 32-year-old woman named Emily. Emily had been experiencing irregular bleeding and was found to have an abnormal pap smear. A colposcopy revealed CIN3, and she underwent a LEEP procedure to remove the affected tissue. While the procedure was successful in treating the CIN, Emily later experienced complications during her pregnancy, including cervical insufficiency leading to preterm birth. Her case highlights the importance of monitoring and managing potential complications associated with cervical excisional procedures. In conclusion, to recap, cervical excisional procedures are critical in treating high-grade cervical intraepithelial neoplasias, with colposcopy and biopsies being the gold standard for diagnosis. Human papillomavirus infection and tobacco use are significant risk factors for developing CIN and squamous cell carcinoma. While cervical excisional procedures like cold knife conization and LEEP are effective, they carry risks such as cervical stenosis, preterm birth, and cervical insufficiency. We encourage you to engage with our pre- and post-podcast quizzes and utilize Anki flashcards to reinforce your understanding of this topic. These tools are designed to enhance your learning experience and ensure you grasp the key points discussed. Thank you for tuning in to Med Madness. Stay curious, stay informed, and continue your journey towards medical excellence.